Most nurses are already doing care management. They just don't call it that. And I want to start there because after more than 20 years in nursing, that's what I've seen over and over again. Whether I was working in long term care, in the hospital, or managing complex patients over time, the core of my work was the same. I was following up on appointments, checking labs, communicating with physicians and other healthcare providers, coordinating services, educating patients and families, and making sure things didn't fall through the cracks. That is care management. So, the purpose of this video is simple. I want to bring clarity to what care management actually is, what it is not, and why nurses are already practicing it every single day, often without realizing it. Let's start with what care management actually is. Care management is longitudinal. It's not a one time interaction, it's not a single phone call, it's comprehensive, patient focused care delivered over time. Care management is relationship based. It's built on knowing the patient, not just their diagnosis. It's understanding how their conditions interact, how their social situations impact their health, and what barriers keep them from following a plan of care. Care management happens largely outside the exam room. It includes follow up between visits, patient education, and care coordination across providers, settings, and services. Think about a patient with diabetes, hypertension, and heart failure. Care management isn't just what happens during a 15-minute office visit. It's what happens in the weeks and months in between, making sure medications are understood, catching issues early, helping patients manage their condition in real life, not just on paper. That is care management. Now, let's talk about what care management is not. Care management is not case management. Case management is often episodic and utilization focused. It's frequently tied to transitions, acute events, or specific episodes of care. Care management, on the other hand, is ongoing. It's proactive. It's focused on stability, not just discharge. Care management is also not discharge only follow up. Discharge calls matter, but they are just one moment in time. Care management continues long after a patient leaves the hospital or skilled nursing facility. It's about preventing the next crisis, not just responding to the last one. And care management is not a task based checklist. That part is important. Care management is not about checking boxes and moving on. It requires clinical judgment, prioritization, knowing when to intervene, and knowing when to escalate. Two patients can have the same diagnosis and require completely different approaches. That's where nursing expertise comes in. Now, let's talk about how nurses are already doing this work. Nurses are trained to think long term, longitudinally. We're trained to look at the whole person, not just the immediate problem. We naturally follow up, educate, coordinate, and advocate. If you've ever followed up on labs, coordinated appointments, called a patient after discharge, communicated concerns to a provider, helped a patient navigate barriers to care, you have done care management. This is not new work for nurses. What's new is that the healthcare system has finally started to structure it and recognize its value. And this is where care management becomes powerful. When care management is structured, it becomes consistent. When it's documented, it becomes visible. And when it's recognized, it becomes sustainable. This is why organizations like CMS, the Centers for Medicare and Medicaid, and other insurers pay for care management services. Coordinated, ongoing care improves outcomes over time and reduces unnecessary utilization. Care management works because it's intentional, and nurses are uniquely positioned to deliver it. In this video, I wanted to help you see that care management is what many of us have already been doing quietly for years. In the next video, I'm going to explain why CMS actually pays for care management services and what problem they're trying to solve by doing that. If you're a nurse or nurse practitioner trying to understand where you fit in today's healthcare system, this foundation matters. Stay with me, and I'll see you in the next video. And if this was helpful, like and share it with your nurse friends.